All right, good morning, everybody in the US. Good afternoon if you're located in Europe or elsewhere. Before we get started, we wanted to do a quick introduction for the folks that are attending the meeting here and leading this webinar from around the globe. So from the Vuzix side, I'm Matt. I head our business development. Matt Margolis is my full name. Paul Travers. Paul, you're on here. You want to say hello and just introduce yourself quickly for everybody if they may not know you?
Yeah, this is Paul Travers. I'm the president of Vuzix.
Sam, you want to say hello?
Hi everyone, I'm Sam.
Ed?
Yes, I'm Ed McGregor, Director of Investor Relations.
Awesome. I think I'm going to, Warren, you're on as well.
Hello, this is Warren Russell from Business Development in Europe. Thank you.
All right, I'm going to pass the baton over to the folks in at 1 minute.
Yes, hi everybody, I'm Kevin Semmelink and I'm a part of the development team of 1 Minuut.
And my name is Louise de Wijk and I'm from Sales and Marketing.
Yes, thank you. Back to you.
All right, thanks everybody. All right, so we're going to begin here. Appreciate you attending today. We're going to talk about remote healthcare solutions with our partner 1 Minute. They're doing some great stuff in the Netherlands and in the US, and it's very exciting, and they have a great product that works well with our smart glasses. So a little bit of background on Vuzix. We've been in the wearable display area for more than 20 years. We really started out making thermal weapon sight engines for the US military. We launched our first smart glasses product in about 2014, and now we're on our call it our 3rd generation of product. We're based in the US. We're a public company. Intel owns 13% of our company. They're our largest shareholder. And at the bottom right of your screen, that's our HQ in Rochester, New York. It's about a 40,000 square foot facility. Holds our manufacturing, development, sales, and marketing. A lot of our, basically all of our core business operates out of there. We do have offices in the US, Canada, UK, and Japan. If you look at our business footprint, we do have a large focus on enterprise. If you look at the Fortune 100, it's more than 40% of those customers have our products in one way, shape, or form. Some are working on rollouts and plans. Some might be just getting started, and others are building their business around Vuzix, and it's very exciting. If you look at the value-added resellers, we have more than 200 of those. These folks could be integrators. These are companies that may take software and hardware and bundle them as a project. Others are value-added resellers that actually go and will develop software for our hardware and sell that as a package. Then our enterprise customer base is more than 2,000, includes both small and large. What's great is our products can scale and our business can support both large and small companies. We have a number of MDMs that we support and that type of thing. So it's it's great for large and small. When you think about Vuzix, what we do a lot today is the connected worker. This may range from warehouse and logistics, so barcode scanning, online order and fulfillment, using the glasses to get a pick list, to navigate hands-free, to pick things, realize where to go, the quickest route, that kind of thing. On the manufacturing side, it's about work instructions, quality assurance, that type of thing. Field support, a lot of people can't travel today, so they need to keep their business running through using our smart glasses to de-risk their business and keep operations moving, whether it's training, field support. And then telemedicine, this is an area where 1 Minute, our partner here, excels. This is about training and procedure assistance, and really just helping out with aged folks and just really reducing risk in the current environment. Right now our glasses are being used on the front line. Medical facilities are using our M400. We have folks that are doing kind of triage support, delivering subject matter expertise over the glasses to connect folks that maybe they're in quarantine. They can't provide the skills and on the job, but they're able to provide that remotely. Then you have folks doing kind of a Grey's Anatomy where they're using it in surgery and delivering the point of view from the doctor. And then obviously remotely servicing patients that they physically can't touch, but they still need to interact with them virtually. And our friends at 1 Minute here, they've been doing a lot of business with Vuzix over the last few years, and they've put out a number of videos. So if you ever go to YouTube and you plug in the 1 Minute page, you'll be able to see a number of videos, different ones they've put out, different use cases, different scenarios, and I think you may actually see and hear some of those today. So that's a great reference point if folks want to go and see the different use cases and the way that the 1 Minute solution is being used with the Vuzix hardware. And we talked about the M400. This is really the leading device out there in enterprise. It's the most powerful version out there. It runs Android 8.1 with a path up to Android 10, supported by a line of wearable accessories. It's also rugged, it's waterproof. Last week we did a live webinar and we put the M400 underwater. Didn't drop the call, the video performance was still great. So this is drop tested to 2 meters on concrete. What's nice, it has a beautiful OLED display with a 10,000:1 contrast ratio, 8-core processor as well. So this thing's really meant to be used in a streaming environment. It's great for the healthcare space. And the camera, it's a 13 megapixel camera with image stabilization and phase detect autofocus. So what this means is you're getting a very crisp camera, you're getting a great view. And if you just wanted to use the device for recording, you can record 4K video right from the camera. And then, what Vuzix has kind of worked on, and we've heard a lot of feedback and people want different run rates of battery and use case. So we have a number of batteries that provide, 2-hour runtime on the existing IP67 rated M400 glasses. Then we have an extended use, which is also mountable on our existing rail system. That gives you 4 to 6 hours. And if that's not enough, we have an option that it could be belt mounted or put in your pocket, and that gives you 8+ hours. So really, depending on the job, the use case, how heavy you're going to push this, we have a variety of options. The other thing we've done is we've supported a number of different environments and workers. So if you have glasses, you need a prescription, we support those. You can wear your existing glasses, and then our glasses will just kind of work on top of those. Hard hat, we have mounting options for those. Safety glasses, if you're in a lab or an environment where you need protective gear, we have mounting options for those. And then the headband, this one's really great, whether it's in healthcare or other places. It really offsets any of the weight, which is still very lightweight compared to the competitors. And then also we're left or right eye mountable. So think of your phone, just like your phone, if you have it portrait and you flip it to landscape, the display will change whether you go from right eye to left eye. And then we've added support for hats, safety bump caps and visors. Again, another way just to push the technology out of the way. You forget you're wearing it. It's very comfortable. A great way to go about your business. And then for Vuzix, we have a number of products in the market. We do have our M series products. That's from left to right, our M4000, which will be available later this summer. The M400, which we're shipping now, which is second from left to right. Our Blade, which looks like a kind of a regular pair of smart glasses, is a great product for enterprise, security, first responders. Prosumers, you can also watch Netflix on there. And then Vuzix, we do have a kind of an OEM business as well, where we will support companies that want to bring smarts and technology to their products. So we have our waveguide technology. We can build, design, develop, and bring into production a product that might help bring smarts to your key product for your business. So if you need anything, reach out to Vuzix, we can help you there. And then, we offer a variety of products in the market, ranging from $2,500 down to $799. Each one of these really has a distinct feature or chipset or use case that really kind of drives the price. So we have a variety of options that will work for you. And before I pass it over, so there's a messaging area in the forum, so you can ask questions. We're going to answer those at the end, so you can just simply put your questions in there. We'll read those at the end. And then I'm going to pass this over to 1 Minute. We appreciate your attendance. There's definitely a large crowd out there, and we're happy that everybody could join us. So here, I'm going to pass it over.
Yes, okay. Well, thank you. We will tell you about 1 Minute and Genzo, and we'll let you see some short movies, use cases, live demo, and we talk about Corona. 1 Minute is a Dutch company, and we create innovative technological solutions for healthcare. As you all know, the number of elderly people is increasing rapidly. As a result, the demand for high quality care is growing. And in order to provide quality care to more people with the same number of care professionals in the future, we must come up with some smart solutions. And our focus is on easy, safe and mobile communication by using smart glasses. All our solutions are made with the help of healthcare professionals.
Yeah, so 1 Minute's main focus is to deliver highly secure video streaming and recording through our Genzo mobile software platform. So what does the app Genzo? Genzo creates the possibility to transfer instantaneous knowledge from anywhere around the globe. It allows you to enlarge the effectiveness of your expert healthcare providers as they serve a number of healthcare providers or informal caregivers in practice at the same time. So Genzo facilitates an easy-to-use, safe and mobile communication platform for chat or video call using Vuzix smart glasses. And herewith, we deliver medical expertise across multiple use cases in healthcare. I will give a small example, but we will soon discuss the various use cases. So for example, a nursing specialist carries the smart glass. The doctor watches live on a phone or tablet via the app Genzo and sees what the nursing specialist sees. The doctor assesses the situation and provides the nurse with tips and advice. So together they determine the follow-up actions. The point of view of the nurse or any other care practitioner wearing a Vuzix smart glass makes it easy for external, highly skilled colleagues to give help. The caregiver can work hands-free during the entire conversation and is receiving audio and visual feedback on their Vuzix smart glass. And this is coming from the specialist. Genzo uses EU-based GDPR compliant software to share medical data safely to and from patient files. So in short, we are ISO 27001 and NEN 7510 certified, and we do not share our data with third parties. And we can send you the white paper on request. In addition to the use cases in hospitals and nursing homes, it's also possible to use Genzo for other use cases. An example of this can be seen in this video. Down the audio. Can be seen in this video. So here we use the Vuzix smart glass to fulfill the last wish of an elderly resident of one of the nursing homes, namely to enjoy the sunset view from a hot air balloon. And with the use of the Vuzix smart glass, she was able to share this moment with her family, other friends, and the fellow residents of the nursing home. So as mentioned before, the motto of 1 Minute is easy, mobile, and safe. You reacted by that.
Yeah. We will tell you about our several use cases. We have several use cases: informal care, wound care, behavioral observation, medical scribe, 24/7 medical assist, education, and social. I won't explain them all to you. We can send over some information if you would like to. But for example, the wound care, complex wounds must be professionally cared for, and this requires a higher educated level of expertise. Therefore, the care worker wears a smart glass during the wound round, and the wound expert can look through the eyes of the care professional and at the same time give instructions and report in his files. So that's a very nice way to use the smart glass. Okay. of course, we are all busy with Corona because everywhere in the world, we have to beat this Corona. And in Holland, we use the smart glass on the cohorts. For example, we have special Corona cohorts, and the smart glass are proving to be an efficient way to reduce the number of care professionals at the location with Corona. For example, specialists in the hospital can support just graduated doctors and nurses remotely. The specialist geriatric has a cold and cannot be present in a quarantine cohort, but he can still work from home and do consultation remotely by the use of the smart glass. So we have a lot of examples for you. If you would like to hear more about it, we can send that also. And that's for the time being for now.
Yeah, so I think it's time for a demo.
For the demo.
Yes. Well, let's go live. Let me share another screen. Yes, so during this demo, we're going to show you some of the functionalities of Genzo. And these functionality of one of these functionalities is of course video calling, but I'm also going to show you a drawing on a stream, pointing something out. We can send text, etc. And during this demo, Louise is playing the nurse, and she's carrying the Vuzix Smart Glass. It's an M400, and I'm playing the specialist. So the screen you see is the screen I see, so a specialist sees on my mobile phone or tablet. And I'm at home in this case, and Louise is at work at the hospital. And now we wait for Louise to call because she needs my advice with the patient. A patient called Jeff, and Jeff fell out of a tree last week and has a giant cut on the top of his head. So she's calling.
Hi there, Kevin.
Hi, Louise. How are you?
Yes, fine. I want you to look with me because I'm going to Mr. Jefferson, and I want you to look with me at him.
Yes.
So I will go to him and tell him that you're going to look with me through smart glass.
Yes, it's okay.
Hello, Mr. Jefferson. I'm wearing a smart glass, so the doctor, Kevin, can look with me to your wound. I will look at the wound, so I will talk to the doctor, but you know that he's looking with me, okay?
Yes.
Okay, so here is the wound, Kevin.
Yes, I can see it. Well, it looks nice and clean. Does it look red?
No, it's not red.
Oh, it's not like it's the wound closed properly.
Yes, it's getting close.
Oh, and what's the strange discoloration on the head look like? I will point it out to you. Let's see, it's over here.
Oh yeah, I can see it. I will go more close. Look, it's a little bit dark, but it's not open.
Oh, well, it looks like a birthmark to me. Let's keep an eye on that. Could you show the wound again?
Yes, I will do that.
Yes, so I think it all looks fine, but could you please put a bandage over this part?
Okay, yes, I can do that.
Yes, so...
Yes. And further instructions, or is that enough?
No, I think it's enough for now. Yeah, I think it's fine for now. So to all the other people, as you can see, it's possible to watch Louise and provide her with information. And I can draw something and I can point something out, and I can also send her a text message. So let's say, for example, and Louise sees this on the screen.
Oh, Mr. Jefferson, the doctor tells me you're a very handsome man. Okay, well, I'm going away now to the other patients. Thank you for your time, Kevin.
Yes, we'll keep in touch. Bye.
We'll keep in touch. Bye-bye.
So, as you have seen, it's possible to use Genzo in a use case in which the nurse needs an assessment from a doctor who's not physically present. So, This has some advantages of saving time on both sides. The quality of care is more assured, and also the risk of contamination during this corona time is reduced. And in addition, the use of the Vuzix Smart Glass in this way also has the advantage that the nurse increases her expertise. So, well, as mentioned, we use it in this way in the Netherlands. And about that, we have a small video of how we use it. So let me change the screen again.
Genzo comes with all the necessary features you can expect from a modern communication app. But unlike similar apps, Genzo can be used in combination with a smart glass. It allows you to make video calls with both your hands free. This enables the healthcare professional to safely provide expert care at any time and place. We call this remote medical assistance. Together with the smart glass, Genzo allows healthcare professionals to look simultaneously with a caretaker. This allows them to immediately give support, guidance, or even examine from a remote distance directly. Genzo makes the care process more efficient, but still giving the same high-quality healthcare to the client. With Genzo, your healthcare organization can easily communicate in a safe and mobile environment. Genzo, easy, mobile, safe.
Yes, and I think that was it for us.
Yes.
I think it's time for Q&A.
Get over to Matt.
Okay, we do have a few questions at this point. This is Ed McGregor. Is the 1 minute platform limited to the Netherlands? There's question marks here about Europe, US, and Asia.
No, the 1 minute platform is not limited to the Netherlands, Europe, or Asia.
No.
Okay, and another question. Is it legal in the Netherlands for physicians to do remote diagnosis via media? This questionnaire mentions in Germany it's generally forbidden.
I'm going to ask that to my colleague.
Oh, sorry.
Yes.
Yeah. Okay. Is it legal? Well, it's legal to do remote diagnosis. Yes, we have the allowance from the government to do that, but we don't. You still have to need a file to report what you are doing. So it's all about communicate and bringing the expertise to the caregiver, and you can make some actions, but you also need to write it down in your reports, in your dossier. Is that the answer? Is that okay?
Hello, this is Martin from 1 Minute as well. What we mainly do is connect two healthcare professionals with each other. So there is actually more communicating than that there is actually being treatment done, which is extended by the professional. So in most cases, this is a professional to a professional talk instead of using partners or of such.
And that's for the question queue at the moment. Actually, we have one more that just popped in. We have two more that popped in. Let's see. How many units of smart glasses have been purchased by your company to meet COVID-19 needs? That's more of an investor question. And I think the answer there is we put out several press releases to date that have indicated some units. And there's been a couple of orders for 100 units thus far, plus a few others we haven't quantified.
Yes.
So Kevin, Louise, Martin, I have a couple of questions I can ask here. So are there any restrictions on the minutes or usage? So if somebody gets a license, is there any restrictions on usage?
No, there's no restriction to it. You can use it anytime at any place. anywhere.
Yes, you only need a
The
physical
Genzo,
smart. Yeah.
yeah, you need to get you need the Genzo and the smart glass.
And then as far as like devices you support, I saw phones and tablets. Does it also work on PCs from the application, the remote expert side?
Now we believe that you have to be mobile, so you can work everywhere, anywhere. And I will hand over to Kevin because we are.
Yes, we are planning to do a desktop version or something like that, but it's on the planning. So I think we're going to build that late 2020. Yeah, so it's not there yet, but I think in the future it will be.
Well, I think if you think about doctors, they're always on the go, the professionals. So typically they
Yeah.
have a phone with them. So just having the ability to be mobile, I think is super important.
Yes,
Yes.
we think so too.
And then I think there might be some questions of folks that, what does a typical onboarding cycle look like? How does that process work? If I'm a facility and I want to deploy, what does that kind of cycle look like? And how long might it take to get up and running, and how quickly can that be done?
Well, because of the corona now, we can do it in about 8 hours to keep on running in an organization. We need the organization name, and we make your own environment in Genzo, and it's easily for you to do it yourselves. So the people can invite themselves to your organization, and you can give them an okay or not okay if you don't want them to go in your organization, and you can use it. So that's all it takes. And we give some training online. And we have several films, movies to help you with instruction. So we can do it in short time, especially now.
So I have one question. I know we want to be sensitive here, but can you guys talk about a little bit about your pipeline, what you're seeing in terms of inbound requests and stuff as it relates to COVID, and how that's kind of changed or pivoted your business, and kind of what you guys see going on, whether it's locally in the Netherlands or even kind of worldwide, whatever you can share.
Yeah, well, what we can see is that everybody now sees the need and the urgency of remote medical assist. We always believe in remote medical assist, not only in times of corona, but we believe that you can work more efficiently and productively if you use a smart glass. Because if you have like 2 doctors in your company, and they have to take care of all the people in the elderly home or in the hospital, how do you work with them efficiently? Well, I think that is what remote medical assist is all about. You can say like we make a digital consult, sorry.
Consult, yes.
A digital consult, and one doctor is always on remote assist. So you can always tell him to help you. And now in times of corona, in the Netherlands, we have a lot of law and rights, and it's always a long time to get to the appointment that we are going to work together. And now you can see that because of the emergency, we sold the smart glasses and our Genzo app in a week instead of 3 months. So everybody sees the needs of this remote medical assist. And that's really the difference. In normal times, people say, oh, how can we change our process? And there's a lot of problems by doing that. And now everybody is changing because we all have to work remote. So the bears are gone. The bears are on the... So yeah, that's what basically is different than other times.
So I'll ask one more, and then we'll get back to the queue, Ed. Are you guys seeing a lot? What's the feedback been? Are you guys seeing a lot of customers coming back and adding more licenses? I mean, how's that look from a feedback perspective from the customers you have, and what are they saying?
Well, the feedback is that most of the times they think the smart glass is easily to use because you only have 3 buttons upon it, and it's easy to make contact with the Genzo app at any person. Sometimes it's difficult because technology is not always doesn't always have the main focus for a nurse or practitioner. So, but when we get feedback also on the Genzo app, we try to make it better, more easy than it already is. And they come back to us, and in the same time now, we did some pilots in West Brabant, and they're coming back to us to do some more pilots in other use cases. So we see that it's experimenting, and then they come back to do more of use cases. So I think that's great.
That's great. I'm going to pass it over to Ed. I think we got the queue is filled with some questions. If there's anything else that comes to mind, I'll jump in.
Okay.
Okay, thanks, Matt. Yeah, there's a bunch of questions here. Let me just dive right in. Okay. What type of connectivity do we need for the smart glasses? Can we use a SIM card? And also, do we need a mobile phone?
Yes, you just need a normal internet connection. When you can, when you have a good Wi-Fi signal, it's perfect. You can also use a SIM card and a MiFi router, and so yeah, an internet connection is fine. That's all you need, on both sides, of course.
Okay, let me see here. You have some basic authentication in place right now. How do you authenticate the end user?
Well, authentication is done by the organization itself, so by an admin of the organization. And we're working on an authentication method based on a mail address or something. But for now, the admin of the organization does the authentication.
Okay, and has this gone from proof of concept into an actual use case for customers at this point?
How do you mean? Our customers are the elderly care and the healthcare.
I think, I'm sorry, Ed's question is, are people just doing proof of concepts, or actually just using these in their kind of everyday business would be kind of the way to say it?
Okay. Well, it can be used at both. So I think we have special use cases, but you can use it in every situation when you need some medical assistance. So it's both.
Yes, but mostly people use it nowadays for special use cases. But we hope to see in the future that they are going to use it for, well, everything.
Yeah.
Luis and Kevin, are people just testing it right now, or are they using them live? I mean, I think you guys are out and folks are using them live in day-to-day operations and managing and solving problems. It's not just testing.
No.
No, they are being used right now in several healthcare organizations like elderly care, where we have corona cohorts, but also for the wound care, for the behavior, the difficult behavior. The psychiatrist will look at remote distance. So no, it's everyday used.
And now with corona, it's also used at the IC units.
Yeah.
Live. That's great.
Sorry to break in. Here's Martin again. At the moment, we have 179 M400s being used in the primary process of mainly elderly care. And we've talked about the use cases already, at least. The entry in the hospitals is new for us. This is not in a testing, it's just skipped the testing. We went straight to supporting them on the corona units, and we're building on this as well. And the international recognition is coming in as well, because at the moment we have Austria, Spain, Argentina, the northern part of Chile, and England doing requests in doing exactly the same as we do in the corona cohorts at the moment.
Yeah, and this webinar is no different, Martin. In just a short day and a half or 2 days time that we've told people we were doing it, it's upwards of 200 folks that have signed up to participate and watch and listen in. I mean, the numbers go up and down as people come in and out of the particular webinar, but still the interest is quite high.
That's great to hear. That's, whoa, enormous numbers. Yeah. Thanks for the support, man.
Hey, we appreciate, Martin, we appreciate what you're doing to help with the front line and the folks in need. I mean, it's great to pair up two technologies together to deliver, you know, value right out of the box. I think that's great for us.
Thanks,
Yes.
man.
Thank you.
Certainly the nurse could take the blood pressure,
Yeah.
pulse,
Yeah,
et cetera,
That's
and
what I
then
meant.
their O2 levels and all of that. So, you know, all of those technical stats around the patient certainly could be available through the nurse. And then, of course, the doctor gets to see through the nurse's eyes effectively what she's seeing.
Yes.
Hey, Kevin and Louise, what do the patients think of the glasses being used in the field?
Oh, that's a nice question, because every health practitioner thinks that it will scare them, but like in the demo, it's very normal for people. If you come in, you say, hey, I'm wearing a smart glass and the doctor is looking with me, and most of the people don't even see it really. And some people ask, what do you wear? And then we tell them, and if they want to, we put them on their face so they can experience themselves, and they really like it. So it's really nice to see that the clients and patients don't really bother.
And then you mentioned something about other use cases. Are you guys looking to expand even outside of medical? Is that potentially what's going on? Or is it, I mean, it sounds like security wise you could. What other use cases are you guys seeing?
Well, we also but it's also healthcare. Everything we do is healthcare for now, but not only elderly people, also the psychiatric.
Psychiatry, yeah.
Because in Holland we have also care for people with disorder on the mind, the physical or the
Physical disorders.
yes, physical disorders, and we also use it for how do you call it? Also remote assistance.
Misunderstood behavior.
Yes, like misunderstood behavior, but it's not for elderly people only, but also for people like my own age, and the doctors will connect with the psychiatric, and they will get also remote assistance. But also when people are really a threat for themselves or for other people, you can lock them up to give how do you call it? A treatment, and there also it's used for. So it's all for healthcare.
Great. So you've seen an expanded use case within healthcare. It sounds like, just from, you know, patient care for folks that maybe weren't mobile and couldn't leave a facility, down to now kind of frontline with emergency situations and even behavioral challenges as well.
Yes, that's correct.
Okay, we have another question. How many participants can we have in a session? Can two remote users with smart glasses communicate directly via the platform?
4.
Yes.
So for now it's 4.
So that means that even if you are in elderly care, you can also ask a specialist in the hospital to look at the same time with you. So that's very, very nice and efficient also, because the client doesn't have to go to the hospital anymore. You can put the specialist to the client, so you don't have to bring the client to the hospital.
Yeah, you can have, you can inform 4 people at the same time, so it's time efficient.
I also see a question about the cleaning from the M400.
Yes, well, I think you can answer.
Yes,
Yeah.
shall I answer it? Because you can easily clean it, especially now in Corona times, but also without that. You can easily clean it with an alcohol.
Yeah, ethanol.
Yeah.
Yes, disinfect.
Disinfect the
glass.
glass.
It's waterproof,
yes.
so it's pretty nice.
Yeah, alcohol wipes work. There's Lysol wipes that will work. There's Clorox-based, chlorine-based wipes that will work. There's a lot of material. There's a lot of solutions that can be used. The plastics are very robust. So yeah, you know, fuel oil and stuff like that is not great because some of those acetones can melt the plastics. But for the most part, any of the normal cleaning products with antiviral and bacterial fluids in them work well with the glasses.
Oh, so what languages do you guys support today, Kevin, or is it kind of agnostic?
No, it's Dutch and English today, but I think in a week, well, 2 week tops, we support Spanish as well.
That's great.
So yeah, and after that, I think well, maybe German or no. Well, we're working on that. But Spanish, I think in 2 weeks, I think we have a Spanish version.
There's one or two questions related to who is using this. So I guess the question is for 1 minute. Are you willing to discuss any facilities that are using this? And then one person mentioned any UK organizations. I'm not sure to what degree you like to answer that at this point, but is there any information you can provide?
You mean like if you want to share some names of organizations who are using it?
Yeah, I think some of the questioners are looking for some examples if you're willing.
Okay. Well, we did it for a long 5 years with Argos Zorggroep. Really nice name. And we also have some movies on YouTube about them. So they are really into this.
In every project, we have made a video, like a success video of the using of the glass. And on our YouTube channel, you can find all the companies that have participated in this project.
Yes. Yeah, except from some new ones, but I think almost everybody is on the YouTube channel.
Okay, that's great. Here's another question. Has this system been used by first responders, such as ambulance workers on the scene of accidents?
Well, we are working with not the ambulance right now.
No. Yeah, the ER.
Yeah,
the ER is the SCR. Yeah.
Okay. Yeah. So we do it on the ER, but it's the first time for us. Just like Martin also said, we have the most experience in elderly care, and now we're also in the hospitals. So we would like to go on the ambulance.
Here's another question. Basically, we're talking about the M400. Can the M300 XL, work with the system as well? And what is the difference in terms of capabilities between the two solutions working on your system?
What we see is that the M400 is has more pixels, so it's better. It's better for wound care, for example. So the M300 is also very good, but at the M400 you can see that for wound care the pixels are better. So it's better for the wound care specialist to see the wound.
Yeah, it's dependent on the use case.
Yeah.
So it works on both glasses, but in case of the wound care, M400 is required because of the better camera. But well, if you only want to talk, the M300 it's also fine.
All right, so I think that's come to the end of the Q&A. Martin, Paul, if you guys have any closing statements, anything you want to share, feel free. The mics are yours. If not, we can close up and thank everybody for attending.
Yeah, just really quickly, on the camera point, the M400's camera is image stabilized and it's got this phase detect autofocus, so it's fast. I mean, it really does a nice job, especially in a worn situation, because it stabilizes the image and it makes it clear and easy to see. 13 megapixel, and you can record 4K with it. So broadcast quality kinds of things. Of course, when you're streaming, you're not streaming that high a resolution, but it's a beautiful camera, really good for these kinds of use cases when you need to be hands-free. And it's exciting that we're working with 1 Minute. I have to say, you guys are pioneers in this regard. You've been doing it for a while. And it amazes to me to see the number of use cases around COVID and ICU care and all of the stuff associated with the crazy world we live in today. And it's nice to see companies like 1 Minute helping.
Thank you so much, Paul, for that wonderful compliment. We are very happy to be working with Vuzix, and if it wasn't for the M400, I don't think we could have made it in these Corona times. So thank you again for this platform, and I hope we have answered a lot of questions, and of course we're open for new ones. So please stay in touch with us and help us fight this Corona crisis.
Keep up the good work, you guys.
You too. Thank you.
Yes, thank you all.
Kevin, Luis, thank you for your presentation. Very informative. Sam, thanks for setting this up. Warren, thanks as well. Everybody, thank you for attending. We're going to record this. We'll have a replay on our website, and you should be able to find that on our webinars tab on the Vuzix.com. Thank you, everybody.
Thank you.